Hello, my name is Steve Matiso. I'm here with a good-sized group in the rain of people from MoveOn.org, and we're here because we're wanting to tell our Congressman Mike Honda that he should continue to fight for change, he should continue to fight for working people, and he should continue the fight for health care now.
And then here's a grassroots, real god dang effort. A real effort. Grassroots. This is grassroots. No one was bought here. You all came here and you weren't bought. And corporate. I almost didn't come because it's raining and I go, forget it. I'm coming over here.
We are here today to demand the Democrats get some backbone. We are here to demand real health care reform. We want the Democrats and President Obama to know that the message from Massachusetts is not to cut and run. The message is fight or you're out. The message is we demand health care. We demand Democrats to stand up and fight for health care. Health care for all, affordable health care for all Americans.
I want to thank everyone for coming out again. As one of the gentlemen said, you are not paid to come out. We didn't bring any buses to bring you out here. So thank you so much. Your dedication is really great. The congressman, we're going to let him know how many people are here and the signs that you have and everything about this so that he can keep on fighting for what we all want, which is affordability and accessibility of health care. I'm going to read a statement. Congressman Honda has repeatedly expressed these priorities throughout the conference process. He's made clear his support for a public option, a national health exchange, and strong health disparities provisions. He's also fought to repeal the antitrust exemptions for insurance companies, to oppose the Stupak amendment, and to increase help for low-income Americans to purchase insurance. The Senate bill has not been decided on as the vehicle yet. At this time, we don't know what the strategies are. And we'll hopefully hear more after the State of the Union, but right now, the Democrats are pulling back and trying to figure out what to do. But it is on their agenda. The conference bill has continued to change, and while Congressman Honda has deep concerns about the Senate bill, he has seen some progress in the negotiations. He's not made any final statements because there is no bill on the floor. There is nothing up right now, so he cannot take a position if nothing is on the table. All we can assure you is that he will continue to fight to make sure that affordability and accessibility is available to all Americans. So thank you again. We admire your persistence, we admire your dedication, and we really appreciate your values as good Democrats, as good people of this country and of this district. Thank you.
I'm a cancer survivor, and I just want you to understand how, as cancer survivors, you get punished for surviving. The insurance companies don't want to cover you. I just went yesterday. I'm 2 years out of my last treatment. Thank God I'm doing okay. I found that out yesterday. 6 months ago, I had a problem. I had a spot on my scan, and we decided to investigate some more. It was inconclusive, so I was scheduled for this scan. I arrived last Monday morning, took my medication. I'm sedated, ready to go through this thing. They denied my scan. Right the morning I'm there at the facility. My doctor, thank God, had to fight to get me the scan. He said, I don't know if I can do it the next time, but at least we know you're okay now. So this is the fate. If you get through cancer, you got to struggle. You can't get insurance. I pay $600 a month with a 30% copay on $5,000 scans. I'm glad to have it. It's better than nothing, but it's a burden for somebody that's not working. This country is crazy. We live in the richest country in the world. Look at the skyscrapers around you. Well, we don't have money to help people. We have money for aircraft carriers and for the Pentagon, for all the games in Iraq and Afghanistan. But where are the people? We're left in the dust.
My name is Antoinette Robinson. I'm a registered nurse. I was recruited in 1982 to this country when they had the big nursing strike. I graduated in 1978. I've worked for Good Samaritan Health System for 26 years, and right now I'm going through breast cancer treatment. I'm going through chemotherapy, and in order to keep my insurance, I have to go to work after getting chemo. Like I'm at work right now, I'm on my break. Okay? What we need in America is a single payer system. Get rid of the insurance company. Every day I have to fight. I have to fight. I have to fight for my chemo medicine, and I pay my premium. If I do not go to work while I'm on chemo, I pay $1,400 a month for, and I hear people saying, oh, we're going to have to pay for undocumented workers. We do that every day because everybody uses the emergency room. And so all we need is a single payer system. We need to take Medicare and stretch it out to everybody, and people who work pay in the system. That's what we need.
And my husband was recently laid off. We just found out it's going to cost us $2,000 a month to continue with our family's COBRA coverage, which means we will be uninsured because that's just unaffordable.
Shannon is going to speak here. She's gone through a terrible situation. She just lost her husband, who's on a heart transplant list, and I just want you to hear her, whatever she can say about what's happened. She's still fighting with the insurance companies. This is a real person that's struggling with this crazy situation in our country, so please give her your support.
Yes, my husband of 29 years died on Thursday of a heart condition, and I think a lot of the reason he died was due to stress, and the number one cause of stress in our life in the last 13 months has been United Healthcare. They were our secondary carrier, and they used every trick in the book to get out of paying our medical bills. First, they tried to say we had a third carrier who was responsible for paying stuff. No third carrier exists. Then they said we had a gap in coverage. No gap in coverage exists. So all the doctors sent all their bills to United Healthcare first, and it wasn't until the end of July that we found out that actually Medicare was primary. And so everybody had to rebill everything. Then when everyone resubmitted their claims, and they said that they were beyond the 90-day time frame for submitting claims. And then they let it slip when I called them on the phone that the 90-day time frame does not apply if you're the secondary carrier, because they know that'll take 90 days to 6 months for Medicare to pay, and then you can only bill United Healthcare after Medicare pays. But in the meantime, my husband got so upset. I said, is this stress making your heart condition a lot worse? I hope it isn't. He said, it definitely has.
And I'm originally from Germany. I've lived in France and I've lived in Canada. And I was very happy with everybody's healthcare system. And I can tell you one thing, there's nobody in these countries that I've lived in that would change and take the American system. So the other systems are a whole lot better, even though none of them is perfect, but they're certainly a lot better off than we are.
Obama was elected on a policy of change. We believe in that change. We believe that all Americans want change in a positive sense in health care.
So absolutely, Medicare for all is what we need. Do it by reconciliation. We don't need 60 votes. Just do it.